For facial herpes, an interferon-based ointment is very effective, specifically Vifrin gel ointment. As an ointment, it's suitable for use on the eyes when herpes appears on the eye mucosa. It can be applied to the eyelids as well, and it's also good for putting in the nose. In other words, it works directly on local immunity. And in gel form, it's great for applying to the eyelids, for example, on top, and you can also use it on the chin or on the lips. In addition to this ointment, direct antiviral and antiherpetic treatment is also prescribed. Specific medications include Zovirax and acyclovir, Famvir and valacyclovir as well. These medications are prescribed for a short period, usually 5 to 10 days, depending on the situation. If the lesions are minor, 5 days is usually enough. If we see a larger or more widespread lesion on the face, then it's 10 days. But at the same time, you have to take into account that everyone's immune system works differently. That's why, to support the immune system, we also prescribe and recommend immunocorrective medications. This could be standalone groprinacin or isoprinazine. It acts both as an antiviral and as an immunomodulator. So, for herpes, it's an ideal choice. There are also standalone immunomodulators like Vifrin as an ointment, or Vifrin in suppository form. Polyoxidonium has proven itself very well. Polyoxidonium is actually recommended for both adults and children. For adults, it can be administered with saline or given as intramuscular injections, though those are quite painful. For kids, it's perfect to mix the dry substance from the vial with saline. And it can be used as drops, nasal drops, eye drops, basically on mucous membranes, no problem. You can even just use it topically, like an application. It's a very good medication, has proven itself well. Now, regarding another group, well, about the interferon group. Vifrin is prescribed for adults at a dosage of 1 million units, and for children, 150,000 units. In addition to these medications, there's also Amixin, Lavamax, Amazon. As for treating children, herpes in children, well, that's quite an interesting topic, because obviously you wouldn't prescribe such strong medications to kids. That's why there's a selective and fairly comprehensive medication. It's called Flavizid. Comes in syrup form. It's suitable for treating viral infections and is based on protoplasmid. It should be taken 20 to 30 minutes before meals. The dosage is based on age from 0 years and up, so it's very effective. It's indicated for herpes simplex types 1 and 2, as well as for neonatal herpes. It can also be used for both localized and widespread herpes of type 3, that's herpes zoster, as well as for infectious mononucleosis. Infectious mononucleosis is caused by the Epstein-Barr virus. This is a type for herpes virus. Flavozid is prescribed to children in acute and chronic forms of disease. It's also used for chickenpox. There's also type 6 herpes virus, HHV6, which causes rash-like eruptions called roseolavirus. Only children get this illness. This type 6 virus is also called childhood roseola, or what's known as 3-day fever. It's also called sudden exanthema, pseudorubella, or 6 disease. There are various names for it, and it's characterized by an exanthema, a kind of redness. Roseolavirus appears in early childhood, up to 2 years old, and doesn't require any special treatment. And here as well, if viral hepatitis is found in children, Flavizid is also suitable, including for HIV, AIDS, and hepatitis B and C. So it's quite a universal medication available as a syrup, not as an injection or some strong tablets, just as a syrup, and it's very effective. As for cases where we see recurring herpes, then the course of the medication is extended. As a treatment, it is prescribed for at least a month. That is, you can follow this treatment regimen for a month. But if we observe recurring herpes, then the medication is extended up to 3 months.